We've traditionally approached disc problems with surgical intervention, meaning the immunocategory removing damaged tissue with the goal to relieve pressure. But there's another option worth considering: non-surgical spinal decompression. As you know, surgery provides immediate structural changes through direct access to affected areas. It may achieve successful nerve decompression in some cases. However, some studies suggest it may potentially affect adjacent spinal segments over time. It's hard for me to be objective on this subject, and I am doing my best here because I'm in my fourth decade of treating clients, and I only see the non-successful cases, and I'm sure there are successful cases of back surgery, but they would have no need of my services if all went well. I'm just saying, right? But we need to be objective on what experts mean by the term successful. And this terminology is not just used by the medics. The alternative crowd can be worse. So let's unpack this. Are you 3 months asymptomatic, or is the problem fixed? Okay, here's what I do know as going into my fourth decade of treating back, neck, shoulder, and hip, and so forth problems. And what I do know is what the actual efficacy of non-surgical spinal decompression is and what is not. You know, our success rates are incredibly high with this treatment. But here's the kicker: that success really comes down to two critical factors. First, we have to make sure the patient is actually a good candidate for this type of therapy. Not everyone is, and that's okay. Second, and this is huge, the practitioner's skill level and their deep understanding of how the spine actually works makes all the difference in the world. And this is why I can't stress enough how important it is to find someone who's not just trained, but truly expert in this field. You want a practitioner who really understands spinal mechanics inside and out, because that expertise is what separates marginal outcomes from incredible ones. So here's a bit about this technology. Non-surgical decompression uses controlled stretching to potentially change pressure inside discs. Some imaging studies suggest this may encourage natural healing processes, with research indicating possible disc rehydration over multiple sessions. The risk profiles differ significantly. Surgical interventions carry documented risks, including potential complications, infection rates that vary by procedure, and possible scar tissue formation. Decompression therapy reports occasional muscle strain in a small percentage of patients, with temporary discomfort that typically resolves quickly. Recovery patterns also vary. Post-surgical recovery involves functional limitations that may persist for weeks to months. Decompression protocols often allow patients to continue modified activities throughout treatment. From a cost perspective, decompression protocols are typically less expensive with no hospitalization requirements. So, in conclusion, both approaches have their place in managing disc-related problems and should be viewed as different tools appropriate for different situations. Treatment decisions should always be made in consultation with intelligent and qualified healthcare professionals who can objectify and evaluate your individual case.